the law of Ukraine on medicine. Dear colleagues, finally, we have something happened that must have happened several months ago. The Parliament approved amendments to the law of Ukraine on medicine. And you remember there were a lot of articles and information that at present children, babies don't have vaccine BCG to vaccinate them. That vaccine was at the storage facility, but there was no opportunity to apply that at present because of amendments to the law of Ukraine on medicine. There is a permission to use 5,900 doses of vaccines, and they are delivered to all regions of Ukraine where there is a need, and in sanitary and epidemic stations, and doctors are waiting for the law to be published. As soon as it is published, right away, all children, all babies that were not immunized after they were born, it's fine. This time that lapsed, that passed, is fine. Immunization should be done according to the calendar of vaccination, but because there was such a postponement for that, that will have no consequence for the health of babies. The task of the Ministry of Health cannot to allow such postponement, and all the children very soon will be able to be immune. Interfax Ukraine. Olga, tell me, what will be your, maybe you have a plan to work your plan in the new parliament in the field of healthcare. Not just a plan. We have a strategy and we have a tactic, and I'm responsible. And during last month, since the time when I started to work as an advisor for the president, I was developing the reform of healthcare system, and medical military doctrine was added, and I developed it. And also, I'm responsible for agreeing for development of a coalition agreement in the part of reform of healthcare with all political forces to be in the coalition. So we develop a strategy. As soon as the strategy is finished, we agree it with the World Bank and the World Healthcare Organization, and then we will work. And now I don't see any obstacle, and the strategy will be developed for the nearest 2 years, and it will be brought to not just a discussion, but for people will know about that. As to the amendments, don't you think that cancel re-registration can turn into a risk for people, because we don't have a system of pharmacological control? How can we keep a track of not good quality medicine? I would like to explain the content of that law. In 2012, Ukraine passed a law, a European law, on that it is not allowed to use in Ukraine that medicine which was not registered, didn't go through a GMP accreditation. Because of that law, those vaccines, that law, this amendment to the law will not work for some time. That was the way we solved the local problem, because there was a vaccine which was purchased, and the state spent $1 million over hryvnia. And if we didn't solve that issue about the registration, and the vaccine was the date to be used was 2015, and that has a local influence only if there is a permission for registration of those 500 5 those 5,000 doses that are in the storage facilities. And so because the law was passed and European standards of quality, we were not able to use that, and this amendment allowed locally to sell locally with just one problem of those BCG vaccines. For those 1 million revenue of the state was not wasted for that for babies to be immune, and so and that law has no influence on the quality of medicine. It was cancelled. It will not be cancelled. There will be no such cases when we will have to apply it. Because when new laws are adopted, some amendments are not. We have them amendments because there is not enough done. So only vaccine that passed the GMP registration, we will purchase only those vaccines, and there will be no problem. So that amendment to the law, that's a local solution. If the parliament considered that law before, that mothers would not be concerned, and mass media would have less of concern, and we wouldn't have we wouldn't have kids, babies would be immunized. We should not build a global process. When Bogomolets makes 10 private conferences, says in the parliament, please pass that law, because for million revenue we have in storage facilities. We have a vaccine for 1 million revenue, and 500,000 kids, babies cannot get that immunization. These are wrong approaches. The state, the Ministry of Healthcare, the service, it should be done in a way that we don't have such problems in the future. Thank you. I would like to clarify about vaccines. There was a problem in Ukraine that vaccines in Ukraine, they were Russian. They could not be used, but they were attractive because of the price. How it is planned to build a strategy with vaccines, because we don't produce vaccines. What is the strategy of the state? Should we cancel all those supplies we have from Russia? We are developing that strategy, and we had a meeting with the World Health Organization. They confirmed that they could support Ukraine for the period if there is a problem with purchasing vaccines. I mean, financial problem. So we held negotiations, and they confirmed they're ready to support Ukraine for short term. In the future, that issue will be one of the components of the reform of healthcare system, and procurements of the state. I hope there will be a law which will make these procurements will procure from producers. Maybe we could have long-term contracts, for example, not to have a contract just with them for 1 year, but for 2, 3, 5 years. That will allow to reduce the price we pay. Or we should have negotiations with the Ukrainian producers and that can produce vaccines in Ukraine. We'll do that in the near future. There's some issues we have to solve right away, and with the reform of healthcare system, we have links with other reforms. A reform of military reform that should have place, and there should be defense reform. We should approve and territorial, administrative, and tax reform, and only with the help of judicial reform also we can have the reform of the system of healthcare system.
And now we fruitfully cooperate with all this working group. For example, the issue of vaccination will remain in the scope of the state budget and state funding. The family medicine issue will fall within the responsibilities of local authorities after administrative and territorial reform, and the family doctors will be in their funding will be in the budget of the oblast. Thank you, Ms. Olga, for your comments. We have a lot of issues about healthcare reform.